Dr. Karla Montague-Brown is a family medicine physician from Nashville, Tennessee, who worked for years promoting wellness and natural healing when she was struck with a debilitating illness with two diagnoses: an autoimmune disorder and inflammatory arthritis. Stay tuned to find out Karla's story, a natural healer struck with an illness normally treated with medicines like steroids.
Autoimmune Balance podcast with Dr. Ince emphasizes the interdependence and importance of a healthy mind, body, and soul.
Welcome, Dr. Karla Montague-Brown from Nashville, Tennessee. Thank you for joining us on another episode of Autoimmune Balance podcast. So I heard that you wrote a book about recovering from autoimmunity. Can you tell me a little bit about your story and how you came about to write the book?
Oh, sure. Yeah. Well, let me start kind of sort of at the beginning. For a long time, from the time I was about 10 or 11 years old. Oh, and thank you so much for having me. From the time I was about 10 or 11 years old, I knew I wanted to be a physician. I didn't know any physicians in my family, or I didn't know any physicians that looked like me, a young Black girl from Memphis, Tennessee. But I would watch this show on TV. It's called Marcus Welby, MD. And I just loved that show. And in the course of 30 minutes, he would just solve the problems of all of his patients. And he was just so kind and patient. And I wanted to be like that. Fast forward, I went to college, went to medical school, and it was challenging, but I did realize that dream of becoming a physician. And so for many years, I practiced as a family practice physician. But one of the things that really was dear to my heart was not just the diagnosing of illness and then treating whatever the illnesses are. And a lot of times in medicine, we do that, and we see illness from the illness standpoint, not so much from the prevention, but seeing patients and writing prescriptions. And that was pretty much the standard, but I was still always interested in health education and like, what can I do and what can my patients do to take care of themselves? But in that space of traditional medicine, it was kind of hard to do. But that was still something dear to me for my own self.
So you are correct, Dr. Montague. Often we are trained to look at the end result of years of unhealthy living. So it's almost like the cat is out of the bag at that point.
Right. And so, that's still important, because a lot of times that's what we see. People, if we don't know what to do, or if we just gonna do however we do for whatever reason, then you have to treat what you see. But I was just, I guess because of illness in my family, I was at this space of wanting to make sure that I'm an older mom. I was older having my children. And I just wanted to make sure that, I got to make sure I'm healthy for my children, so that I'm not having the heart attack or the stroke, and they're having to push me around. They're in kindergarten having to push me around in a wheelchair. This was my thought process. So some of the things that I have been learning on my own outside of the medicine space, I just started to practice those things and thought I was doing a great job. And then as I got older, started seeing my patients my age having these illnesses. So then I wanted to, then I became afraid of being ill. So really trying to be in that preventive space and, exercise and doing all the things that I would try to tell my patients, even if that wasn't what they were wanting to do. And then I just wanted to be healthy, because I realized that I'm a child of God. Then fast forward,
So basically you were taking care of yourself.
I thought I was. I really was. I mean, I was intentional about taking care of myself, learning what I could and trying, and it's a journey. You know, I don't want to paint the picture that, oh, I'm doing everything right, but I was intentional about being healthy.
Okay.
And as a matter of fact, I had started a gratitude journal, and had written in my journal. And it was after I became ill, I was looking back and I realized a few days before I became ill, I wrote in my journal, Lord, I am so grateful to have good health.
Wow.
I remember I was not, it was not, I didn't take it for granted. Felt like I was at the time, I think I was 57, but feeling like I felt when I was 47. Felt healthy. I was grateful for that. And about a few days after that, I woke up and I just felt kind of stiff, achy. And I told my husband, I was like, man, I don't know why my body is feeling achy, or I'm feeling stiff, like we've been moving stuff in the house, or I've been working out, but I hadn't really done any strenuous exercise. And the only thing that I could think of that was different was I had taken care of my niece's kids, and she had a small child, a baby, and I had lifted him to change his diaper, things like that. I said, well, that's the only thing that I've done different. And we laughed about it. My husband and I joked about it. He's like, yeah, you're old trying to take care of a baby. It's been a long time since you've taken care of a baby. And I thought, okay, I'll be fine. In a few days, I'll take some hot showers, soak in the tub, and I'll be fine. But day after day, it got worse. And over the course of maybe a 2-week period, I felt like I had gone from this 57-year-old vibrant who felt 47 to what I would imagine a 97-year-old. I literally, every part of my body, from my neck down to the bottoms of my feet, hurt. I was stiff. I started swelling. My joints started aching. Every joint, it seemed, the paired joints, my shoulders, my knees. I could barely move, and I knew
So it felt like you had run a marathon and you actually hadn't run a marathon, or
hadn't done much of anything, but I felt like either I had run a marathon or a Mack truck had run over
or a Mac
me.
check. Wow. Wow.
It was not good. And what was frightening about this is I had been healthy. I had never had anything like this. In the past, maybe a sinus infection. And I was even at the point, even if I got a sinus infection, I could clear it up without medication. I was, had been on that type of track. So no real major medical problems that I was on medication for. And as a matter of fact, years prior, I had had a bad reaction to some medication a couple of times, and so had been real leery of taking medication. So I think that was another reason why I was on this track, to take care of myself as much as I could without medication. So here I am now with something that I was hoping would go away on its own, but it wasn't. And at that point, I realized, okay, it's time for me to go see my doctor. And this is not, and I'm a physician, so I knew that, okay, clearly this is getting worse and not getting better, and something is wrong. And so to make a long story short, I went to my doctor, told her what was going on, and I was just so tired. That was the other thing. I had seen patients who came in complaining of chronic fatigue, and I understood fatigue from the standpoint of, okay, I've been running, or I've been exercising, I've been doing all this stuff, or I've been on call all night and worked the next day, and now I'm tired. I
So
understood that
so
type of
so
fatigue.
this was not a normal tired.
This was not the
You could
normal. This was,
you could
I'm
you
waking
could.
up tired.
Mm,
I'd take a shower, and I would have to actually lie down before
mm,
I could finish drying off, and
mm,
then dry off, then put some clothes on. Then, like,
mm,
I was doing nothing, but I was so
mm,
tired. And I
mm,
was still going to, I do medical consulting for the state. So I was still going into the office to do
mm-hmm.
that work, and I could barely walk. And so I knew then I needed to go and get some lab work done, see what's going on. I didn't know if, and at first I thought maybe I had the flu, but I had no fever, no cold symptoms, just this pain and stiffness and fatigue. And that became frightening. And so when she took my doctor did some lab work, And then she texted me and it's like, I think we're gonna have to send you to a specialist. I think you might have lupus, which is, she said, we don't know if it's lupus, but some type of autoimmune disorder because the numbers that they checked, like what they call the ANA titer and the markers for inflammation, the markers for some type of autoimmunity, they were very elevated. And so when I saw the numbers, I'm like, oh yeah, this is scary. I had seen patients and referred them to specialists because of the same type of things that I was dealing with.
So,
And
Karla, can we just briefly tell our listeners what is autoimmune disease?
okay, briefly in the nut. Now, there are several different types of autoimmune disease, but what the overlying culprit is, the body is essentially attacking itself. The immune system is the body's protective mechanism to ward off infection or other foreign entities that can attack the body. So if you have, say, with the flu, your body's immune, you have certain cells that will go into on attack mode to take care of this problem. Even the skin is part of the immune system. So we have when it's working normally, it's the body's protective mechanism to ward off things that are foreign that's trying to attack the body. Well, in autoimmunity, that means this system has gone haywire, so to speak. And so the body starts attacking itself. It starts seeing its own organs as foreign. And so any part of the body can be attacked, from the brain, the lungs, the heart, the joints, the skin. The body starts seeing these cells as foreign. And so it starts to attack itself. And
Okay.
mhm.
So it's like an army that is commissioned to protect the country, and suddenly they go haywire and start attacking their own people.
Yeah, like friendly fire, so to
Yeah.
speak, but it ain't quite friendly. Yeah, it's
Okay.
like the army attacking itself, thinking it's doing a good job.
hmm
And so it's this immune system is in overdrive, but it's attacking the wrong thing. It's
And
seeing,
it can attack just about any part of your body, your joints, your heart, your
yes.
liver. Or so tell me, you said you got to the specialist and they gave you a diagnosis, and then you were home free?
No, they actually gave me two diagnoses, and it was a while before I even got to the special. My primary care, you know how medicine is. This is another thing that I started to experience, even though I had been a patient in certain ways, as going to get my physicals or
hmm
maybe an infection or something like that. But now I was in the system, not as the provider, but as a patient,
As a patient, it's a whole
dealing
different
with the
ballpark.
specialist, dealing with having to wait to go see, all the whole nine. So
Getting your insurance
the
approvals
insurance
and
approvals and all of
hmm
that. So by the
hmm
time I got from my primary care, and she said, I'm going to send you to a rheumatologist. And so the first rheumatologist that I was going to see, it was about 6 weeks before I could see them. And the day that I was going, my car broke down. And so I'm like 2 or 3 minutes from their office, and I called to let them know what was going on. I was like, I'm
hmm
on my way. End up having to get an Uber, and I'm going to make this real short,
Wow.
but I'm just letting you know
No,
it's a lot going on here.
tell your story. I'm gonna
And
get you back.
so I called my husband, said my car is broke down. He said, okay, I'm on my way. I'm going to send an Uber to you. I'm going to come in an Uber, and then I'll let them take you, and I'll see about the car. So I called the doctor's office because I'm a new patient and I needed to be there early. And I said, like, I'm not going to be there at the time you say, but I'll still be there before the appointment time. So by the time the Uber gets there, so I'm on my way. I said, I'm about 2 or 3 minutes away from their office. They called me, and I was like, I'm on my way. I had already called them, and they said, well, you're going to be too late. And I'm like, it's been 6 weeks. I've waited for this appointment, and I'm still going to be early. I will still be on time or even early for the appointment. But the response was, well, you're going to be too late. Do you want to reschedule now? And I was so heartbroken. And
Mm.
then I'm like, really? Satan, this how you gonna do this? And then I said, well, God, is this you? Is this not where I need to be? And so I told the Uber driver, I said, no, I don't want to reschedule. I said, and I asked him, I said, can you just take me home? And he said, ma'am, you've been through so much today. I'll take you wherever you need to go. And so I ended up finding another rheumatologist, which she has been a godsend. And so she diagnosed me with two different autoimmune disorders. One was inflammatory arthritis, which explained why my joints were swollen and why every joint hurt, because my joints were what was being attacked. But then she also said I had undifferentiated connective tissue disorder, which is kind of a catch-all term where they really don't know exactly what. I didn't have all the markers for lupus or one of the other specialized named disorders. So they call it undifferentiated because I did have abnormal labs, and that was why my muscles were so sore and why I was so tired, because a lot of different things were being attacked. And so those were the two diagnoses that I received, but they wanted to put me on medication. But when I first went, of course, they're still doing lab work. So they didn't really know what was going on. And initially I said, well, I don't want to be on medication until we know what's going on, because we're treating symptoms. And then, like I said before, I had some problems with medication. And I said, well, with all the side effects, and then I don't know if we will be masking what you need to see so we can know this is, and I guess this was part of the medical training coming out, to be able to say, well, I will take medicine if I need to, but I need to know what we're treating first and not just mask the symptoms. Now, unless I'm getting ready to die right away without taking this medicine, let's just wait till the rest of the labs come back. But in the meantime, I had been teaching wellness, and there were some principles that I had been following that I just began to maximize. It's like, okay, Lord, what has triggered this? And what do I need to maximize, even in the space of holistic wellness that maybe I'm not doing to the best of my ability, or that I may be overlooking. And so I had started, and my doctors, I had talked to my doctors about that I was wanting to wait to take the medicine, but that I was still trying to do something to help myself. And so they were in agreement, and then, you don't want to let your patients go and like, oh, you got this and I'm doing nothing. So, but I thank God that they were able to listen and know that, okay, we're not just sending this person out with, she's doing something, but they were like, but if you get worse or if something happens, make sure you get back in here so we can get you on the medication. So we actually were working together as a team. I had to trust my doctors, but I thank God that they
So
were trusting me.
Karla, were you ever on the traditional anti-autoimmune disease
No,
modifying agents?
they initially wanted to put me on prednisone, my primary care, and I said, well, let's just wait. And then the rheumatologist wanted to put me on the Plaquenil, which is one of the modulating agents. And like I said, I knew so many people that were on these medicines and were doing horribly. I said, well, if I'm going to be doing bad anyway, I don't want to be on these medicines yet. That will be affecting my bones, my kidneys, so there's benefits and risks to anything. And I don't want this to go out and for people to think I'm against medications, because I'm
Right,
not, but
right.
I do think in their place, because sometimes we do need it. But if
Yeah,
they
so
are,
I'm a medical oncologist, a cancer doctor, and I have often met patients who wanted to go the natural route or holistic route. And, I've kept in contact. Sometimes it worked and sometimes it didn't work. So I'm more of a traditional physician who wholeheartedly believes in a healthy lifestyle and medicine, food as medicine. So, so and I find it just fascinating about the approaches of of lifestyle to the for the treatment of autoimmune disease.
Mhm.
And for instance, the book Goodbye Lupus.
Yeah,
You
Goodbye
shared.
Lupus. Yeah, that was one of the books that I read
Okay, I was wondering
as
if that's what you were inspired by, but go ahead, tell me
yeah, and I
your
think we have a
journey.
similar
Mhm,
philosophy
mhm,
because
mhm,
I'm traditionally trained,
mhm,
but I also embrace the holistic. And so definitely,
mhm,
if I need medication, let's
mhm,
do it. So that, and I'm glad you brought that up because I don't
mhm,
want people to, because sometimes people do want to do a holistic thing, but that can be difficult if you don't know what to do and if you don't
mhm.
know how to
Right,
do, and
right.
it
I I
requires
I I
different.
believe a marriage of the two. Yeah,
Yeah, absolutely, absolutely. But
right.
yeah, Dr. Golden's book was a friend of mine. When I was telling them what was going on, they thought I had lupus, and she recommended that book. And I
Uh-huh.
liked it because it mirrored what I was doing. A lot of the things that I was doing, I was like, oh, okay. So, and it gave me a sense of kind of affirmation and a sense of
Mhm,
hope because my traditional doctors, while they
mhm.
were okay with me of trying this, had to kind of figure it out on, from my own study. So then when I saw her
Okay.
book, that did encourage me. And but anyway, today I'm going to be demonstrating my green drink. And this is one of my staples of what I really used when I became ill with autoimmune disorders. I had a lot of inflammation, and someone shared with me some ingredients, and I had no idea what I was really doing, but she gave me these ingredients, and I've since added to it, but I'm going to share you my basic green drink recipe. And I started doing this, and I felt my body start to heal along with some of the other things that I was doing. So I'm going to make this real simple and share the ingredients, and then I'm going to juice it.
I
And then so just to recap, my ingredients are kale, cucumber, celery, Granny Smith apple, lemon, ginger, turmeric, parsley, and I didn't put pineapple in this one, but generally I use pineapple, and it tastes really good and it's good for you.
so one other thing, because you were so healthy and you were, struck down with this illness, did that discourage you and like shake your faith for a hot minute?
Absolutely, absolutely. Because I'm
Mm-hmm.
thinking, well, what did I do? Why am I? I teach health. I said, who's gonna
Yes.
listen to me?
Yes.
And I'm
Yeah.
and I thought I was practicing what I was preaching, and I was. And
Mm-hmm.
something that my husband shared with me, because that's exactly, I did feel discouraged, and I did feel
Mm-hmm.
like, well, was any of this even working? And my husband said, Karla, if you hadn't been doing the things that you were already doing, you probably wouldn't be recovering the way that you are, even though you're sick. I don't know what triggered to make me ill, but he said if you hadn't already been on that track, you probably wouldn't be able to um, do the things that you're doing. And even in the time that it did take me to recover, because I was pretty sick for a while. I thought I was getting ready to die. My doctor didn't
Mm.
tell me that, but that's how I felt. And I was kept praying like, well, Lord, I said, I'm trying to do all the things. And then how
Mm-hmm.
am I going to help people if I can't even get out of the bed? I can't even go upstairs in my house for like months.
Mm-hmm.
I had to just stay downstairs. And
So turned what made you turn the corner to hope?
well, I kept praying, and it was not until, I mean, I got to that point where I was really agonizing and it's like railing. How they say, well, you can just talk to God. I learned how to really pray for real, and not I couldn't even get on my knees to pray, but I just
Mm-hmm.
remember thinking, Lord, if this is your will, I don't want this to be your will. I don't like this. But I got to the point where I just had to say, well, Lord, if this is your will for me, if this is my time to die, I don't want to die not praising your name. I said, but if this is for me to just draw close to you, but then to be able to help somebody else, then your will be done. Because I was praying for the miraculous healing, like the woman with the issue of blood. I was like, Lord, I'm touching the hem of your garment. I have faith. I want to wake up and be well. And I woke up sick day after day. But it was not until I released it and just said, Lord, your will be done. But help me to do the best that I can to take care of myself. And if this is my time to go to sleep, then so be it. I give it to you. That was when I got this sense of peace, but also the thought, and I think it was God's spirit saying, this is for you to get close to me and to trust me, but this is not just for you. This is for you to be able to help somebody else from a different
So what
vantage point.
what I've often said is that, many times we want to know, why did you get this illness? And or why do bad things happen to good people? I don't
Right.
think we have all of the answers. I mean, I'm sure the stress of living in today's society, running in here and there, definitely increases the risk of autoimmune disease. But I'm agreeing with your husband. If you had not been healthy to start with, who knows? You may have, succumbed to autoimmune disease years earlier. Because I
I
read
agree.
I read in your book online.
I think I have it.
Yeah.
Let me see.
Yes. Yes. Oh yeah.
Yeah,
Oh,
that's
you can. Yes, I read in your book online that at one point you had thyroid disease. Was that? But that was years earlier.
yeah, there was years. Yeah, there was probably about 15 years prior. And
Oops. Oh, I was trying to show them your book too. Oh. But
and yes, you're right. I thought about that as well, because that's considered in those categories of autoimmune. So something's been tried, probably attacking my body for a while.
right.
But
Mm,
because I had been intentional about doing some things, and it's a growth process. I want people listening who might feel like, well, I haven't been doing anything. Wherever you start is where you start, and the
mm,
body has amazing capacity to
right.
respond
Right.
negatively if we're doing things that harm us. And you think about, sometimes we do things and it takes a while for the body to succumb to it. So it has an amazing ability to respond in a positive way when we treat it well, when we
Okay.
learn what to do.
So as we wrap up, tell me specifically, what are some of the steps that you attribute to your healing? Because you certainly look well now.
I'm doing so much better, and it took I guess about a year. But I could feel myself gradually getting better. And the process I call my business is Crown to Soul Wellness. And Crown to Soul is actually an acronym for the process that I use and that I teach. And I'll share with you what Crown to Soul, and that soul is SOLE. So the C is for control or choice, like it as in self-control. And so it really is a mindset as I began to think in a way of wellness, as the Bible says, be transformed by the renewing of your mind. And so I was depressed, I had anxiety, and I had to just come to a place of peace. So that C is for a choice. I had to choose that I wanted to be well, or even in my sickness, to have a mindset of gratitude. The R is for rest. And you mentioned, a lot of times we're busy with the hustle and bustle, and a lot of my clients are professional people. They're accomplished, they have education, they're busy doing all the things. And then I think because we're so driven, because we're doing so much, we're just not resting as well as we need to rest, and resting physically as well as mentally and emotionally. So I
So
had to be
you weren't resting before, or?
I would go to, I mean, because I was the kind, I would go to sleep. But I think when I say rest, I think
Mhm.
sometimes I know I was busy. I was busy with work, busy with, my family,
You have
busy
two,
in
you had
church.
two, your kids, are
I
they,
have two I have two sons, and
are they,
they're
are they
young adults.
grown? Okay.
Yeah, they're young adults. They still live with us. And at the time that I got sick,
Which
my
wasn't,
youngest
it
had
wasn't
just
that long ago. It was about 5 years ago,
about
just
5 years ago.
before the pandemic, just before the
Right,
pandemic.
yeah, a couple of
Hmm.
years before the pandemic, and my youngest had just turned 18, which is, I share this in the book too, that I had prayed years before for me. I was like, Lord, you gave me these kids. I'm older. I want to just make sure that I get to see them grow up. And as
Hmm.
soon as my youngest will turn 18, 6 months later is when I got sick. And I'm like, Lord, I didn't mean it like that. Come on, I ain't ready yet. Let's renegotiate. And this was actually what I thought, but the R is for rest. And so I think I was doing so much good things, but I think I just still needed to just allow myself to physically as well as mentally and emotionally rest, knowing that I can't do all the things all the time. So help me to pace myself. O is for outdoors air. I was working mostly inside. So even though I would go outside, I wasn't I think that's just important to get outside, intentionally breathe fresh air.
Did you suffer from anxiety and depression before the illness, that as far as you
Right
know?
after I had my younger son, and then we thought it was just a postpartum anxiety.
Mm-hmm.
And I was treated for maybe a month, with medication, and we thought
Mm-hmm.
it was just a hormonal thing. And so that was like
Mm-hmm.
20 years prior. So I
Mm-hmm.
really didn't have a major problem with that, just some I mean, I could deal with it with, prayers and, making sure I eat right, but not where I needed medication at that point. But it was
Mm-hmm.
not actually after the pandemic, I had a major bout. I'm serious. I
Oh
mean,
yeah.
where I was like, was better from the autoimmune, but then in
Uh-huh.
2020, when everything was crazy, I
Uh-huh.
had this severe anxiety with panic attacks and all of that. And
Uh,
I
for
thank God I'm past that now as well.
for many of
Still,
us, yes.
yeah,
Mm-hmm.
yeah. So yeah, I did have
Okay.
some of that, and so
Mm-hmm.
then so I think even with when we think of wellness, we have to approach it from a holistic standpoint. So the mind, the emotions,
Mm-hmm.
even the spiritual aspect as well as the
Mm-hmm.
physical.
Mm-hmm.
The W, that stands for water. So my beverage of choice is is water. I try to, now some people don't do the bottled water, but I have to make it easy for myself. And
Well, what about those green smoothies from, do you
that
drink the green smoothies from the, I call her this smoothie queen, the Lupus
No,
Goodbye
I
author?
did do the green smoothie, but I started making my own, and that was my initial where I when I said I had to maximize what I was already doing. I
Mm-hmm.
wasn't doing that before, but a friend of my brother's who was in like a naturalist or naturopath
Mm-hmm.
shared this recipe with him, and he
Mm-hmm.
shared it with me, and I had no idea really how to do it. I just started using my kale and cucumber and
Mm-hmm.
lemon and
Mm-hmm.
things like that, and I started doing that twice a day. I think
Okay.
she said to do it like 8 ounces twice a day. So it was nasty. It tasted horrible, but I'm like, if this is going to help me, I'm going to do it. If it's going to give me nutrients that will take care of the inflammation in my body. And that was one of the things that I start doing. And I share that even with my clients now. Some things you're just going to have to change. But now I do it and it tastes pretty good. I've learned how to put pineapple in it. And
Okay.
so,
How often do you do that?
um, now that I'm a lot better, I don't do it as often as I probably should. But when I start feeling myself a little ache, I'm like, "Oop, I have been doing my green drink." But I was doing it pretty much every day, at least for that
Mm.
first year.
Okay.
Now
Okay.
I still want to do it, but you know how sometimes we get a little, oh, I'm doing good, but then
Mm.
especially if I'm home, I'm able to really control what I eat. But when I go out of town, I still try to eat a certain way, but sometimes if you're not preparing it yourself, you don't know what people may have put in stuff, and so you
Okay.
can get off track. But those are some of the processes that I've used. But definitely the nutrition was a big part of um, the healing, like you mentioned earlier about food as medicine, and I think that a lot of times we eat things that taste good, and because of just there's so much that you can choose from, till we eat stuff that's quick and easy and it tastes good, and that's what we get used to, but it may not always be the most nutritious for
Okay.
you. And so as I started to really think of, okay, what are these things, whatever I'm putting in my body, what is it doing to help me? And so I eat a
Okay.
lot of fruit, a lot of fresh fruit, a lot of fresh vegetables, green, and I'm not a
Okay.
calorie counter or a
Mhm.
thing like that. I just really think color my plate and
Okay.
with
So,
with whole foods.
okay. So, well, I want to end, Karla, by saying that your skin is beautiful,
Thank you.
glowing, and also to affirm you that your testimony was not squished by this illness. In fact, has been enhanced and multiplied. Your book could be found on Amazon and other sources. Overcoming Autoimmunity: One Physician's Step-by-Step Journey to Victory over her
Chronic illness.
chronic
That's it.
illness. Okay. And just on a personal note, we were vegetarians and thought we were fairly healthy, although we lived in the big city. My husband came down with a near fatal illness, fairly advanced lung cancer. I
Mm.
guess it's now, oh gosh, not, let's see, 15 years, 16 years ago.
Okay.
And so our testimony was squished temporarily, but you can always do better in your health journey, and that's what we are attempting to do as well.
Yeah, absolutely.
And I wish you well, and maybe we can have you back on
I
podcast
would
another
I would
another
love
time.
it. I would love it. I think it's so important that we share. I mean, because some people just need that hope of seeing and knowing that you can take control of your
Right,
health, and you can do, even as we see our physicians and they do their part, we
right,
still have, because we're not at the physician's office every day. And even
right,
if we're taking our medications and,
right.
and doing those things,
Right. And we, yeah,
we, we
for my husband and I, we did both traditional surgery, chemotherapy, radiation,
yeah.
and then we wound up at a wellness center, Uchee Pines in
Okay, yeah.
Sealy, Alabama.
Yeah, I
So
use a lot of their
recipes or
recipes, or yeah, I
mm-hmm,
remember
mm-hmm,
years ago when I was, as a child, I remember Dr. Thrash coming
mm-hmm.
to our
Oh,
church.
oh, wow. Agatha
And
Thrash.
she made
Mm-hmm,
such an impression on me, even as a child, even though sometimes the adults were like, we're not doing, because she was one of these holistic, but a lot
mm-hmm,
of the things she said, it just
mm-hmm,
kind of made sense to me even as a child.
mm-hmm,
So yeah, I have utilized a lot of the
mm-hmm,
information from UT
mm-hmm.
Pines.
Okay. So there is hope. I feel like we should end with a word of prayer. Can you
Okay.
pray with us just briefly?
Want me to
Oh,
pray?
yes.
Okay, sure, sure, sure. Oh God, we just come before you with thanksgiving and praise because you are God and you love us with an everlasting love. So, Lord, as we come together and we talk about our bodies and how wonderfully you have made us, we realize that sometimes we do become ill. Sometimes you allow illness to come, and sometimes it's because of our own doing or not doing. And then sometimes we have no control over it. But Lord, we're just so grateful that you have made us in such a way that we have the ability to recover from chronic illness. And so, Lord, as we apply principles that will help us, Lord, we just ask that you will give us the capacity to continue to learn, to continue to open ourselves, open our hearts, to be able to take control and allow you to be in charge. Help us to make wise choices, and as we learn, as we take care of our bodies, help us then to be able to minister to someone else in whatever capacity that is that you have for us. We know that you have gifted us with abilities and skills, and have given us the commission to help someone else. So, Lord, as we draw close to you, as we get well, help us to use what you've given us to be a blessing to someone else. We bless your name. In Jesus' name I pray. Amen.
Amen. All right. Bye.
Take care.
Okay. Oops. Dr. Brown's healthy lifestyle voice was almost stilled, but she came out on the other side of a serious illness and depression during the pandemic stronger than before, with a thriving wellness coaching business. You may find Karla at crown2soulwellness.com. Remember to consult with your personal health care provider before embarking on a new health regimen. Please like, subscribe, and share this podcast. This is Dr. Christine Ince wishing you a healthy mind, body, and soul.